Hello, everybody. My name is Jaycee. I'm currently the respiratory care specialist at UCSD Hospital. By trade, I'm the respiratory therapist. If you were ever diagnosed with COPD, cystic fibrosis, emphysema, you may have encountered a respiratory therapist in your life. If not, the main goal of a respiratory therapist is to help you breathe better. One way for us to help you breathe better is using airway adjuncts or secretion clearance devices. So why use devices in the first place? The body's main way to get rid of some of the secretions is by coughing. Well, let's say you have really thick secretions, it's really difficult for you to get it out. These secretion clearance devices are really helpful to help get up the secretions. Sometimes the body produces way more secretions than it can cough out on its own. But these devices actually help that as well. Since you don't have to cough as much, the less forcefulness of the coughs alleviate some of the pain that you have. Prior to the popularization of the secretion clearance devices, respiratory therapists used the help of gravity to help change the patient's position to help try to drain some of the secretions out from the body itself. So using the devices have less time and manual labor for you. Now, coming from UCSD, we're privileged to use protocols and mainly focusing on the secretion clearance protocol. Basically, the physician, all they have to do is order this, and the respiratory therapist can assess the patient on a daily basis. Based on the respiratory therapist's assessment on the patient, they could basically choose the frequency and the modality of the secretion clearance device. We have a lot of different devices at UCSD. We have over 6 different secretion clearance devices, and not all of them fit one patient. So using that assessment skills of the respiratory therapist really is beneficial for the patient with all those secretions. And you also get that one-on-one therapy with that respiratory therapist, because since we do have so many different secretion clearance devices, sometimes the patients don't have good techniques. And if you have that one-on-one time with the respiratory therapist, they're able to help coach you through the process. Now, some of the most common devices that we have at UCSD is something that you guys are mostly familiar with, is the vest therapy one. So who's the vest therapy good for? Basically, the vest therapy is good for anybody that could sit up or able to move. It's preferably not great for patients with portacaps or any type of protruding lines, or because it might just cause a little bit of pain. But the vest therapy is one of the most common ones, the most frequent ones that everybody sees. For cleaning one, a lot of times too, we get a lot of questions about cleaning because these patients go home with these secretion clearance devices and they don't know how to maintain its patency or just maintain its cleanliness. So my recommendation is always just follow the manufacturer's recommendations. Typically, they'll just say clean it with a warm, damp rag and check to see, because sometimes manufacturers use a machine washable vest. So sometimes you can machine wash your vest and that would be sufficient enough to be clean. Another most common device that we use at UCSD is using the PEP therapy, or a positive end pressure therapy. Basically, this mobile device is really compact and easy to use. Patients can use it anywhere that they want to use. It's typically good for patients that are able to follow commands, and typically the patients with strong muscular strength on their mouth, because you really have to have a good seal for this one to have it to take effect. Typically, if you have really chronic headaches, it's not too good for you just because it has all that continuous pressure and it might alleviate or it might cause more damage to the headache. But other than that, it's pretty neat, pretty mobile, and really convenient. Cleaning for this one, so when I read the manufacturer guideline, it says boil in water. Just to clarify, you don't boil the device in the water. You basically just bring the water to a boil, then you can use the water to clean it from there. Some of them are machine or dishwasher safe, and sometimes even vinegar will help clean up the devices as well. Another most common device that we have at UCSD is something quite unique. This device actually uses acoustic or music waves at low frequencies to help break up the secretions. And this device is actually really good for patients that need that localized area of secretion clearance, just basically the vibratory therapy at one spot of the lung. If you don't have the time for this therapy, though, I might not suggest it for you, just because this therapy session does take a little bit longer than all the rest of the therapy devices, but it's still a great device as well. And the cleaning for that one, you just want to make sure that you use a damp rag or washcloth for cleaning that one as well, and just always follow the manufacturer's guidelines. Now, combination of therapy and with secretion clearance and medications, if you have COPD, cystic fibrosis, bronchiectasis, you might realize that secretion clearance alone isn't going to help your lung function. Sometimes you need the aid of medications, but doing the therapy, then taking the medications at a separate time really eats away at your daily life. Fortunately enough, all these medications or all these secretion clearance devices allow you to use the medications in conjunction with the therapy itself to save you time and basically bring you back to your activities of daily living. Typically, that's found most commonly in cystic fibrosis patients where they have a conjunction therapy, but they usually use it in a sequence when they do this conjunction therapy. The typical sequence that the CFers or the cystic fibrosis patients use is first they'll take the inhaled bronchodilator to really open up the lungs. Then they'll use the hypertonic saline, which is basically like the salty water, as Dr. Wallace said. And then they'll perform the chest physiotherapy via the vest or any form of chest physiotherapy that they deem necessary for their type of secretion clearance. Then they'll take an inhaled DNase or the pulmazine, the inhaled corticosteroid, and lastly, they'll take the inhaled antibiotic. Doing this sequence or this type of therapy in this order is really beneficial for the patient, so that way that none of the medication is wasted or negated from the other or the previous medication. And we found that in UCSD, this type of sequencing really does have a big impact in our patients that have a lot of secretions in them. Now, I just want to take a quick talk about the hypertonic saline because it is getting a lot of popularity here in the hospital setting. You might see a lot of different physicians ordering this one as well. Hypertonic saline just basically uses the power of osmosis, of basically having the fact of rehydrating the secretions in the lungs, making it a little bit easier for it to move and expectorate out to the body. Now, just in summary, the UCSD utilizes the protocols, and like I said, we have a lot of different secretion clearance devices here at UCSD, but using that protocol, we're able to use that and to the patient's best advantage. Like I said, CPT, since we do have all those secretion clearance devices, if you have any questions, you'll have that one-on-one time with the therapist to make sure that you get all your questions answered. And of course, infection prevention is the #1 way to make sure you don't get sick in the future. Thank you.